Hello, my name is Mustafa Hirji. I'm the Acting Medical Officer of Health for Niagara region. Over the past few weeks, we've seen rising case counts in Niagara, including a record 63 cases in one day earlier this week. Ontario also has continued to see record numbers of daily case counts this past week. All of this is putting our community at risk. We've unfortunately seen 13 deaths from COVID-19 since the start of October in Niagara, and with higher case counts, that is possibly only going to get worse. In Ontario, where regions have been put under new provincial restrictions, such as in Toronto and Peel, unfortunately, those have not been enough to change their trajectory of cases continuing to rise. Peel is now at the final stage of restrictions before they would move into lockdown. And we've seen in other countries, such as in Europe, that they have actually had to proceed to lockdown. Our goal in Niagara is to make sure that we protect the health of our population while avoiding that kind of a lockdown that would be really harmful to our economy and to social life. We absolutely need to act now before it's too late to make sure we stop the spread of infection in this way. When we look at our data, we're seeing infections primarily occurring within people going out with social groups. For the past 6 weeks, we've been advising people to stick to just their households in terms of the social interactions. But unfortunately, these urgings have not been enough. When we look at the data carefully, we see that bars and restaurants are one of the core locations where we're seeing the spread of infection continue. We have at least 8 occasions where infection is spread widely amongst parties in bars and restaurants where people have been socializing together. I want to emphasize that operators of these establishments have been very diligent, and the measures put in place have prevented spread of infection between staff and from staff to patrons. What we're seeing is infection spreading amongst patrons who are seated together as a party in a table. This is likely amongst coworkers, amongst friends, groups that are beyond the household where we're recommending people be socializing. To make sure we're able to bring a stop to this, we're today announcing some targeted measures to address this before higher case counts lead to more provincially imposed restrictions. First, we're advising in the strongest terms that everybody dine out only with their households to make sure infection doesn't spread more widely. As well, unfortunately, we are announcing some additional restrictions under the Health Protection Promotion Act to limit social interactions. That builds on the requirement for restaurants to keep records of their patrons, to now have these records also have clients attest that they do not have any symptoms of COVID-19 and attest that they're dining out only with their households. Other measures have restaurants do additional work around ensuring hand sanitizer is widely available and physical distance is observed at all times. I want to emphasize that this is not a punishment of our restaurant operators. They are really victims here of individuals who have had far too wide social interactions in restaurants and unfortunately led to spread of infections. If we're not successful in reducing cases linked to bars and restaurants, we're unfortunately going to project further restrictions by the province. This will include additional restrictions on our bars and restaurants, as well as additional restrictions on our other businesses. Ultimately, COVID-19 can be controlled only by our own personal choices to limit our social interactions, or by imposed rules that forcibly stop these interactions. Today, we've unfortunately had to announce new rules because some have continued to make personal choices that are putting others at risk. Going forward, I want to urge everybody to think about how their choices affect others, particularly others in terms of putting them at risk of COVID-19, as well as others in terms of how it affects our local businesses and puts them at risk of these more onerous restrictions the province might have to impose. If we make the right choices to limit our social interactions to just our household, to staying home if we have any symptoms of illness, to keeping our distance of 2 meters at all times, to wearing face coverings, and to washing and sanitizing our hands frequently, I believe Niagara is still well positioned to change the trajectory of our cases and bring them down just in time for the end of the year holidays when we can hopefully have more openness. Thank you.